As medicine evolves, prevention becomes more and more prevalent. Diagnosing potential risks and, in a way, treating potential problems before they occur can save thousands in surgical costs, time spent in recovery, and most importantly, prevent these problems from ever happening in the first place. Our question is, why not apply this logic to physical therapy?
We have to do certain things. We have to exercise, stretch, strengthen. It's just a matter of educating people and encouraging people to do this consistently. Most people come after they've had a problem, and that's the unfortunate thing. They come in and it's like, my back hurts, and let's fix it, rather than let's fix this before it becomes a problem. But that'll change in time. Your next couple generations, that'll reverse itself.
Physical therapy dates all the way back to 460 BC with Hippocrates. He first started experimenting with a version of physical therapy by massages for pain relief and hydrotherapy, but it was during the 19th century that physical therapy really started to develop. A widespread need for reconstruction aid, which was the original name for PT, was born during the time of World War I with wounded soldiers. In 1921, a group formed by Mary McMillan called the Yankee Women's Physical Therapeutic Association, which later became the APTA, was a hit to making physical therapy what it is today. Physical therapy broadened in the 1970s from just hospitals and war sites to nursing homes, outpatient clinics, and even some homes.
Pros of physical therapy. Well, obviously you learn something. That's the biggest thing. You learn how to stretch. You learn how to strengthen. You learn how to lift something correctly. You learn how to take care of an injury. Those are the biggest pros.
It seems that in today's world, no matter how advanced technology and medicine becomes, it still can't overcome the growing number of back and knee injuries. Perhaps the largest group affected by these injuries is athletes. Every year, hundreds of athletes injure themselves playing sports, sometimes becoming so impaired that they are unable to return to playing their sport competitively ever again. Unfortunately, despite the knowledge that knees and backs are extremely liable for injury, numbers still stay high. Part of the cause of both knee and back injuries is that athletes are unaware of how certain practices are risk for injury. When it comes to knee injuries, which are mostly seen in athletes that need to jump a lot, preventive physical therapy can be particularly beneficial.
Alright man, ready to play 1v1? Of course, dude. You warmed up? I don't need to warm up. What is this? Not gonna warm up. Let's go. Alright, 1-0. Hey man, what happened?
Oh dude, I think I pulled my hamstring.
But in regards to your question of therapy before they get hurt, we do that a lot, especially for ACL problems. We teach people how to squat, how to land, certain exercises for quad strengthening, things like that. So that does help prevent future problems for ACL problems or rotator cuff problems. You teach them how to strengthen the rotator cuff, that kind of stuff. So yes, it is very important and a big part of what we do nowadays.
We'll take them through a test. We'll look and see what is their alignment, how strong are they, and we'll determine, are they at risk to tear their ACL. Once we've analyzed their jump test, I'll come up with an exercise program that involves jumping, strengthening, and stretching to make sure that everything's going to be strong and protect them in the future.
Preventive sports physical therapy consists of measures taken that focus on injury prevention rather than on post-surgical treatment or rehabilitation. Medical care costs have skyrocketed, with more insurance companies making the patient pay more out-of-pocket expenses. Weighing the relatively inexpensive costs of preventive care against the enormous expense of major medical injuries, one can see the cost-benefit of such programs that focus on keeping athletes injury-free. Seeing a physical therapist for preventive care is a low-cost solution to rising healthcare costs. In 2011, our nation's healthcare tab stood at $2.7 trillion. That is nearly 18% of our economy. However, these high costs of medical care could potentially be avoided. While not all injuries can be prevented, billions of state dollars are spent on treating preventable injuries. One injury in particular, the tearing of the ACL, is one of the most prevalent knee injuries among athletes. According to the American Orthopedic Society for Sports Medicine, about 150,000 ACL injuries occur in the United States every year. The same source reports that ACL injuries account for more than $500 million in U.S. healthcare costs each year. The mean total cost of an ACL injury in the United States is around $5,169 per surgery. However, these costs vary depending on insurance companies and coverage.
think it would help immeasurably. People would be stretching, have a strong core, have a nice flexible hip muscles, so they go out and play tennis and the risk of injury is much less. You know, they've done rotator cuff stretching and strengthening. They go out and they serve a tennis ball and it doesn't hurt the next day, or it responds or recovers or heals much quicker. So yes, I think if people did do preventative medicine of exercise and stretching and strengthening, yeah, we'd reduce, 3/4 of our problems.